If you work in healthcare, you're probably feeling overworked, undervalued, and you just kind of feel like a lot of your patients and your coworkers may just not appreciate you. On top of that, salary rates are an absolute minimal, and unlike the tech sector, hospitals are doing nothing to make their employees happy. Did you know that most employees don't even take some of their federal and state required breaks? It's not uncommon for nurses and doctors to go without lunches. It's not uncommon to see nurses, doctors, therapists, and other disciplines go without their normal breaks throughout the day. If you work in the tech sector, you may see a reasonable salary bonus for increased productivity or increasing revenue. In a hospital, increased productivity or making a life-saving catch is just rewarded with your name recognized or a picture on the wall, and sometimes they'll throw a pizza party and some donuts in there too. Healthcare prides themselves with treating employees according to their job status. There's this huge hierarchy, and if you're not at the top, you're kind of compared to the top. If you're a doctor, you're not just making the most money in healthcare, but everyone in the cafeteria line knows that you get your lunch for free. Working in a hospital can be a constant reminder that you're not a physician. And this can actually cause practitioners to withhold critical communication with physicians, poor discharge, lengthened recovery, or other medical errors because no one spoke up. Now, one article explains that these strict defined roles and their importance are overemphasized. And this can have unintended negative consequences in a pressurized environment. Working in healthcare can also cause you to be more unethical and as a result produce employees with low morale. Practitioners may encourage patients to take pain medication for anything minor. And they also may be required to constantly ask patients about their pain levels, which can result in taking pain medicine more often than needed and lead to addiction. If you've ever heard of upcoding, it's a term used in healthcare when patients are billed for a procedural code or codes that were not performed. Upcoding is just a fancy word for overbilling, and it happens all the time in healthcare. In fact, employees and healthcare practitioners are encouraged to upcode. Sometimes doctors don't even know how to bill a patient, and they often bill a patient at a higher cost than what they should be billed for. And it's not just doctors that are overbilling, everybody in healthcare is overbilling. For example, the therapy department, we have these set of productivity standards, and if you don't bill, you're not meeting your quota and you're looked down upon. Now, because of these productivity standards, therapists may actually spend more time in a patient's room and just document so they have more time spent with the patient when it's really not one-on-one time. Or they may just round their time up and say that they were spending more time with the patient than they actually did. And I feel like doctors do this as well. A lot of times when you do an initial evaluation with a doctor, they'll write a complex code that's like an hour treatment code when they're only gonna spend like 15 minutes with you. One way hospitals overcharge patients is they keep them longer than needed. And a perfect example of this happened at the beginning of the pandemic. So at this time, hospitals were discharging patients rapidly just to prepare for the wave of COVID patients that might come into the hospital. This wasn't just at one or two hospitals, this was happening nationwide. Once there began to have less patients with COVID, the hospitals actually began to keep their patients longer. Now you might be wondering, like, how can this happen? Why would the hospital keep patients longer? And it all comes down to profit. Hospitals are not all about patient care, they're all about making a profit. And even the nonprofit hospitals have this same goal. And the quickest way to make a profit is by overcharging and increasing your revenue. So how can we fix this? And how can we help make our jobs more meaningful in the hospital? One way to make your job more meaningful, and this is something that I've done, is just to start your own business or just do a side hustle. Get started with something new and do something on the side. You may even want to do what you're already doing in a hospital and just have like a side job or an outpatient job, just so you have something that's a little bit more meaningful and engaging and motivating you to be a great nurse or a doctor or a therapist. Now, I understand that not everyone can leave their job. And I would say that if you are working in healthcare, one thing that you can do to make a difference is just stop overcharging your patients. Now, this may affect your productivity in a negative way, but usually hospitals aren't going to fire you for just having poor productivity unless you're not doing anything at all. If you feel like you're not making enough money at your current position, you actually can go interview at another facility and wait for them to offer you a rate. If the rate's higher, you can see if your current job will do a counter offer to keep you in that same position. And that way you can keep your same job and be paid at a higher rate. If you're not getting your regular breaks at work, start taking them. And don't worry about what other coworkers think of you. You're entitled to your breaks, and if you don't get them, record them and file a claim with your state labor division. Now, what do you do if you just don't enjoy your job? That's pretty normal, right? Most people don't enjoy their job, but there are ways to make your job more meaningful. And for me, I feel like it's becoming an expert in what you do. Now, let's say you work with patients, but you don't really enjoy your job, you don't really enjoy what you do. Instead of changing your job, try to focus on the patients. How can you make their day more meaningful? And what you can do is actually share these experiences with your coworkers and others around you. And you can actually share what you've learned on social media, or you can start a blog. You could even write an ebook. Now, another thing you can do to make a difference in your job and just to make it more meaningful is to just create a positive atmosphere. There's a story I heard about some plant managers. On the back of their hard hats, they had this sticker that said, "Have a great day." And it just kind of boosted the employee morale throughout the facility. So those small things that you can do can have a huge impact. So working in healthcare is definitely stressful, and of all people, you know what that leads to. If you feel like you need a life revamp or you need a big change, definitely check out my other video on how to make life more meaningful, and definitely read the articles that I have in the link below. So what are your thoughts? Do you have these same problems at your facility? Or what have you done at your job to make it more meaningful? Feel free to share this video with someone who needs to hear this. And as always, subscribe, like, and I'll see you in the next one. Thanks.